To another developing story out of Motherwell in Gqeberha. This is where patients at the NU8 clinic are facing a terrible situation. Many of them, including those on chronic meds, have been turned away because of staff shortages. There's no one available, we understand, to dispense their medication. So the situation is causing frustration and leading to long queues as people wait desperately to be helped. Newzroom Afrika Sipha Kema is there at the clinic. Sipha, good morning. I imagine you're hearing a lot of heartbreaking stories as well.
Absolutely, Iman. I mean, when we first arrived here in the morning and we heard what some of the community members were saying, more especially the patients and the chronic medication patients who say that they've been turned back a number of times since last week. This is the second week now they're going into, some of them without medication, some of them needing urgent care and assistance. But it's not because the clinic is closed. No, it is operational. However, there is a shortages of staff and healthcare workers within this clinic. And what we hear from some of the community members is that this is not the first time this is happening. Same thing had occurred last year as well as earlier on in 2024, last year as well. But now we're going to bring in one of those that have been affected, a patient or a community member that has been turned back since last week, where she was supposed to come here on the 8th of January. Ubusasixelela mama ngendaba yakho yoba bekunzima kanjani wemane nijikwa uza apha uzolanda i-treatment yakho ngoku 2 weeks iveki yesibini ngokungena treatment.
Ngolwesithathu ibi-date yam, so bendizothatha ke ngoku i-treatment yam. Xana sifika apha kuvaliwe negate kungena i-security qha, and ke ngoku besityhuwishile singangeli ubohlobo sililo apha ngaphandle, asivulelwa asixelelwa noba kwathini na. Seye sahlala kwafika iveni yamapolisa. Iveni yamapolisa ufika kwayo yathi uyeza umphathi ofowunelweyo ucela ze sinyamezele silinde.
Sixelele ke ngoku mama uba kudala umane uqhamba apha ujika apha i-affecta njani wena lento as umuntu bemeba utya i-treatment yakho?
Hayi, affecte kakhulu ngoba ke uba ngabana bendisihlelele ngokunokwam bekuzawuthiwa ndidefaultile mandiqaliswe yonke into ekuqaleni. So indihluphe kakhulu ngoba ke ayindimanga ngumsebenzi wasekliniki.
Now, Iman, we just to quickly wrap up what she said is that she came here on her date on the 8th of January. She waited in the queue, in a long queue. I mean, when we got here in the morning, the queue was so long on both ends, where you had mothers with newborn babies as young as 12 days old waiting in the line. She missed the first inoculation, coming in now, trying to get an inoculation that she was supposed to get for a 3-day-old baby, but now the baby is 12 days old. Now, as far as Ms. Mchaka that we've just spoken to now, she was telling us that she was turned back and she was waiting in the long queue in the sun. And then, I mean, she's been turned back a number of times last week. Today she came back also finding the same situation. But we know that there's been a bit of an update now. Quickly, I'm going to bring in Napsal's as Provincial Secretary, Zikazi Ngata. Thank you so much. Let's just quickly talk about the solution that's happening right now. I see people are finally getting assistance and being helped.
We can not even really say it is a solution, because what we have pushed for as NUPSAU is that in as much as we don't have any people to be employed right now, but we have management that is sitting under aircons, in cool offices, they must come and roll up their sleeves. They must come and assist. So that's the only temporary assistance that we managed to push for, which is coming in the form of a mobile clinic that will only be dishing treatment for those who are coming for their dates. You should remember, as you have mentioned already, there are people who are here with kids who are coming for immunization. Those kids won't be immunized. There are people who are here who wants to see their results, who've tested their TB, whether they've got TB or not. Those people won't be able to get such results, which is making our community to be more sick, because people are just turned away, going back home, going back to infect one another with no care, no medication, no nothing. So even this little mobile clinic that just arrived, it won't be a solution.
Yeah.
because it is only for today with only management that will also have to go back and do their own management duties.
All right, thank you so much, Mzikazi. Mzikazi Nkata there from Nabsao telling us, of course, that this short-term solution is not really going to help this community that's been without primary health care, but most importantly, causing some patients such as Ms. Nchagazi that we just spoke to default on their medication because of not having enough staff working inside. Right now, we are seeing a mobile clinic attending to those that have been waiting here, but we've seen a number of them actually going back home as they've been waiting here since 6 in the morning, some as early as 5 o'clock, queuing in this long line.
Sipha, Kema, thanks for that update there from the NU8 clinic.